Good morning. I'm actually not a doctor yet. My name is Savannah Bailey, and I'm a pre-med student. And today I'm going to talk to you about our study on the comparison between robotic and laparoscopic Roux-en-Y gastric bypass surgeries. So this is our disclosures. We have nothing to disclose pertaining this study. So as I'm sure all of you know, obesity has become a huge issue in our country over the past couple of decades. Our current obesity rate is 37.5%. And the big issue with obesity is the comorbidities that have shown to be associated with it, and like diabetes, hypertension, sleep apnea, osteoarthritis, and even cancer. And these comorbidities have been linked to more than 2.5 million deaths in the world per year. It has been shown that bariatric surgery leads to effective weight loss and comorbidity resolution. So, as y'all know, a type of bariatric surgery is Roux-en-Y gastric bypass surgery, which was first introduced in 1967, and it has been shown to be one of the most effective and popular bariatric procedures. The adoption of the laparoscopic technique has improved patient outcomes and has increased the popularity of this procedure. And despite the benefits of the laparoscopic technique, this surgery is still technically challenging and has been shown to have a prolonged learning curve. As of recently in the journal, the Annals Journal last month, it showed that the learning curve can exist beyond 500 cases. So, benefits of robotic surgery. It addresses a lot of these limitations of the laparoscopic technique. It's been shown to provide improved visualization and precision. It's helped with instrument articulation and motion scaling. And it's also been shown to help more difficult cases that require suturing, such as the Roux-en-Y gastric bypass. So, advantages of using the robot in the bariatric field. It enables operations that may otherwise not be laparoscopically feasible. It's also shown to minimize the impact of the abdominal wall, provide operative consistency, and it works when working space is very limited. And it also provides ergonomic benefits to the surgeon. So the objective of our study was to assess the outcomes of the robotic Roux-en-Y gastric bypass and to compare them to those of the laparoscopic Roux-en-Y gastric bypass. We hypothesized that the robotic technique would lead to improved outcomes after the Roux-en-Y gastric bypass compared to the laparoscopic technique. The study was a retrospective review of a patient database. After our IRB approval, the procedures were performed by one surgeon from October 2007 to July 2015. The laparoscopic procedures were performed first from the year 2007 to 2011, and then he switched over to the robotic technique from 2011 to 2015. And we stopped at 2015 so that we could include, because the patients had to have at least 1 year follow-up period. The primary outcome that we looked at was the rate of complications at 1 year after their surgery, and we categorized these complications according to the Clavien-Dindo classification system. Other outcomes we looked at was estimated blood loss, percent excess weight loss, length of stay, and operative duration. Once the data was collected, we used t-tests to compare the continuous data, and we used a chi-square test to compare the categorical data. Now to the results. This table shows the characteristics of the patients that were included in this study. We found that we had 125 patients in the robotic group, 121 patients in the laparoscopic group, and as you can see, the male to female ratio is very similar between the groups. However, the robotic group was older and had a larger BMI than the laparoscopic group. The perioperative data, the big thing to highlight from here is the operation duration, which we found in the robotic group. It was about an hour longer in the laparoscopic group, which is proved to be significant. The estimated blood loss was pretty similar. There was no significant difference there. The hospital day or length of hospital stay was also pretty similar. Percent excess weight loss at 1 year, it was slightly higher in the robotic group. And then the length of the limb and the number of staples used to create the pouch were similar between the groups as well. So now on to our primary outcome, which was the complications. When we looked at the complications 30 days post-op, there was not a significant difference between the two groups and the complications that occurred. However, once we looked at the 1 year post-op complications, there was a significant difference, and the robotic group showed to have less complications than the laparoscopic group. The overall morbidity, when we broke it down between the different grades of the classification system, so grades 1 and 2 were only minor complications. There wasn't a significant difference. And grades 3 and 4 were major complications, and there was a significant difference between those. We didn't have any mortality in any of our patients throughout the study. So some of the complications that occurred were EGDs, hernia repairs, lap choles, bowel obstructions, and wound infections. The only significant difference between the two groups was for the lap choles, but for the EGDs, bowel obstructions, and wound infections, all of the percentages were lower in the robotic group when compared to the laparoscopic group. And we just didn't have enough, our power wasn't big enough to show these differences. So there are limitations to this study. This study was a retrospective review, which does produce potential for bias. Only one surgeon performed the procedures, but even though this could still prove to, it provided consistency for the surgery, for the patient follow-up care, and for the decision-making, since there was only one surgeon. A cost analysis was not completed in this study, and we did not study the effect of the learning curve with the two different techniques, and the procedures occurred during different time periods, which I mentioned earlier. So in conclusion, we found that robotic gastric bypass can be safely incorporated into the practice with excellent outcomes. We did find that in our sample that the robotic group was associated with fewer complications as compared to the laparoscopic group, but additional studies do need to be done to better understand the impact of the robotic techniques. Questions?
Thank you very much. I appreciate your talk. Questions from, well, we can only take one. I'm sorry, we're running a little behind. Go ahead, sir, on the left.
Okay, if I could hear you correctly, it was kind of hard to hear. You were asking about if all of the cases were included in the study? Because they're correct. Okay, yes, all of the cases were included in the study, and like I said, this was only the procedures that were performed by one surgeon throughout those years.
Okay. And then the other, I think, that gets more to your conclusion, if the complication rate is lower, the only thing I saw that was significant was the number of cholecystectomies done, which I'm not exactly sure why that would fall into a complication rate, but I can't really speculate as to why that would be related to a robotic approach. I don't see any of the conventional adverse events that were different between the two populations.
You're correct on that. What we are hypothesizing is that the nausea that is related with the lap chole could have been confused with the gallbladder, but they underwent a lap chole instead. And in the robotic group, our population was older and did have a higher BMI.